Hi, welcome to Fertility Talks. And today is Monday. Happy Monday, guys. I normally don't do it now, but you know what? Anytime's a good time to talk about fertility, right? I'm Mary Wong, and I'm so honored to have with us Lisa Hendrickson-Jack today. Thank you for being here.
Thank you for having me. I'm excited.
I'm so excited because you just wrote a book. It's called The Fifth Vital Sign. I love your book name, just so you know. It's awesome. And the reason being is because people don't really know that the menstrual cycle really is like a vital sign. Not like, it is a vital sign, right? And I'll let you explain more and we'll dig deep. But before we get into the meat of our conversation, I want to just I should tell you who I am for those of you who have never been on this and watching this now. I'm Mary Wong, and I'm the founder of Alive Holistic Health Clinic in Toronto. I'm an acupuncturist, traditional Chinese medicine practitioner of, 26 years. And I'm the author of Pathways to Pregnancy, and which includes personal stories and practical advice for your fertility journey. But today, it's not about me. It's about talking to Lisa here and learning more about the content of your book and really in how it will help you in your fertility journey. And again, before I go on, let's tell everybody about your little bio, which I need to read, okay? So she's a certified fertility awareness educator and holistic reproductive health practitioner who teaches women to chart their menstrual cycles for natural birth control, conception, and monitoring health, overall health. And in her new book, Fifth Vital Sign, Lisa debunks the myth that regular ovulation is only important when you want children by recognizing the menstrual cycle as a vital sign, which is so true. So drawing heavily from the current scientific literature, which she has like thousands by citations, Lisa presents an evidence-based approach to fertility awareness and menstrual cycle optimization. She hosts the Fertility Friday podcast, a weekly radio show devoted to helping women connect to their fifth vital sign by uncovering the connection between menstrual cycle health, fertility, and overall health. Welcome.
That was the long bio.
And this is your short bio. Hello.
Oh, that was a short one. Sorry, I gotta modify that.
I'm like, we need to downsize that. But obviously, you know a lot about this, and you've been doing your fertility podcasts, your Fertility Friday podcasts, which has, how many viewers do you have, or listeners do you have now?
Well, at this year, we're set to hit 2 million downloads overall.
Holy crap-a-roni.
I'm excited. Awesome. We're at like 1.7.
That is amazing. I'm so proud of you. And I'm so thrilled that we're getting this kind of uptake because, it's like this conversation that nobody really talks about, yet we know millions of people are struggling and having issues or just needing to learn about the menstrual cycle, for Pete's sake. So without further ado, let's get talking. So
sounds good.
Let's actually start off with, what the heck is a fifth vital sign?
No, that's a great place to start. I mean, a vital sign is essentially a measure of how the body is functioning. And we're most familiar, I should say, with the four main ones, which are our body temperature, blood pressure, respiratory rate, and also heart rate. And all of us have a sense that if you were to go to the doctor and they were to measure your vitals, any of the four, not only is there an accepted range of what would be considered normal, and so if your vitals fell outside of that range, it's an indication that there's something wrong. But in addition to that, if you were to say, look at your blood pressure, if it's high, the doctor also has a roadmap because there's certain things that could make the blood pressure high, certain things that could make it low. So not only does it give you a general sense of how the body's functioning, but also gives a specific roadmap of where to look if there's something off. And so the reason that, and it's not just me, as you know, Mary, there's a lot of health professionals that are specifically calling the menstrual cycle a vital sign in reproductive age women that we should be paying attention to, because in the same way that any of these other vital signs that we're more comfortable with could give us specific information about health, the menstrual cycle can do the same.
100%. And of course, like, and for those of you who do Chinese medicine, I mean, that's the realm of gynecology. We look at the menstrual cycle as how it relates to your health. So, they may be coming in for, oh, I'm having troubles conceiving. Well, let's look at your menstrual cycle. Let's look at all the other symptoms, actually, right? So thank you.
Well, and one thing just to add to that, often when you say menstrual cycle, as I'm sure you know, Mary, a lot of women just think their period. So you talk about menstrual cycle, and a lot of women will say, well, my period's usually this long. But when you look at the menstrual cycle as a vital sign, it's the whole thing. And traditional Chinese medicine also obviously divides the menstrual cycle into its different phases and looks at each phase. So when we talk about the menstrual cycle, it's not just the period. The period would be part of it. So day one of the cycle, day one of the period. But then we would look at the pre-ovulatory phase. So from a fertility awareness standpoint, when is ovulation happening in the cycle? So how long is that phase? Are you producing cervical mucus as you approach it for how many days? That type of thing.
Absolutely.
And then after ovulation, how long is the luteal phase? Is it healthy? Are you seeing abnormal bleeding throughout? Are you not? So I just like to point out that when we're looking at the menstrual cycle as a vital sign, it's the whole thing we're looking at.
Absolutely. Thank you for that. Because in Chinese medicine, we break it down into 4 phases. Do you break it down? And how many phases do you guys talk about?
Well, I mean, when I'm talking about it, often for simplicity in a realm like this, I talk about the first and the second half. But essentially, if I were to kind of break down what I would be looking at if I was working with a client just to kind of gather information, of course, we're looking at the period. After the period, we would expect a couple of days before the cervical mucus comes in. So kind of how long is that period, what we're seeing, and then the cervical mucus phase in a healthy cycle, 2 to 7 days of mucus. And it can look like the creamy white hand lotion or like the clear, stretchy, raw egg white type. And then, of course, ovulation, and then the post-ovulatory phase. So it kind of blends. There is 4 phases, but I kind of blend them together as I talk about them, if that makes sense.
Absolutely. And for those of you that are new on this, or even just going to the fertility clinics, I mean, it kind of takes the onus off of yourself when you just go to the fertility clinic and do cycle monitoring, because you get your blood test and then you get your ultrasound. But you can do all this at home, right?
Yeah.
So let's talk a bit more about that. And you know what? Actually, when you were talking about cervical mucus, tell us what cervical mucus is and what it's for, and how you look at it. Because I'll also, I've said this, and sometimes women kind of gross out. It's like, oh, I don't touch down there. Like, give us a little practical advice about how to check your cervical mucus as well. Okay. So this is like already a 3-part question.
Yes.
Sorry.
No, it's okay. I'll just jump in. So in terms of checking, what I always say is, there's no woman listening to this or watching this right now that didn't go to the bathroom today. And when she went to the bathroom, like, she wiped herself. So in terms of checking, if you're brand new to this, one of the easiest things to do is just to start paying attention while you're doing the things you're already doing. So you're already going to the bathroom and you're already wiping yourself at the end of it. So one of the ways to pay attention to see if you're producing cervical mucus, and I should also say that you won't be seeing mucus unless you're not on the pill or other type of hormonal birth control. So this is assuming that you're cycling naturally. Women who are on the pill, their cervix is filled with a mucus plug, so they're not going to see this mucus that we're talking about.
We'll talk about that in a second. So let's start with,
but just to illustrate that. But if you're cycling
absolutely.
naturally, then when you basically, what happens is, as you approach your fertile window, if you're going to the bathroom and wiping yourself, women will often notice that it feels a lot slipperier. Slipperier, is that a word? But more slippery. Sure. So more lubricative. So if you're going to the bathroom, many women have had a few different experiences that they may not have known that was related to their mucus. So one example would be, if you've ever had that kind of, you're just sitting around minding your own business and you feel kind of like a wetness and you're like, oh my gosh, I think I started my period. And then you run to the bathroom, but there's no period. So for some women, that feeling might be what's happening when they're in their fertile window and they're actually having some cervical mucus. For other women, they may notice the mucus, but because we're not really taught about it as a culture, they might think that it's an infection. We're often taught about discharge. So if you've ever kind of noticed something on your underwear, you kind of see it there, and you end up in your doctor's office getting tested for STIs and it comes back negative. For some women, that is how they saw their cervical mucus. And for other women, it's just that at certain times of the cycle, when you go to the bathroom and you wipe yourself, either it feels like you have to wipe a few times because it feels like there's something there and you kind of had to get a new piece of toilet paper and wipe a couple times. Or it feels like, my running joke is that it's so slippery that your hand hits the back of the toilet, like, phew.
Right.
And so all of those are potential signs of mucus. And so at the very basic level, in terms of checking, you could literally just start paying attention when you're wiping and or looking in your underwear, just kind of seeing what you see. And why it matters, because you asked, like, what is cervical mucus and why do we care? So particularly for women who are trying to get pregnant, cervical mucus is key to understanding your natural fertility, because cervical mucus has the ability to keep sperm alive for up to 5 days. So one of the examples I've been using a lot lately, just to kind of drive the point home, is that let's say you're trying to get pregnant and you see cervical mucus on Monday. This is Monday, Mucus Monday.
Yeah.
So you see,
love it.
you see mucus today. You have sex with your partner, unprotected sex, and then he has to fly off to China or something. So he's on a business thing and he's got to go. So let's say you see your mucus on Monday, you have sex on Monday, and then you actually ovulate on Friday, but partner's still not here, he's still in China. It is possible for you to conceive on Friday when you ovulate because of the sex you had on Monday, because your mucus can keep sperm alive for up to 5 days. And there's a lot of myths around conception. So, because you work with so many women who are experiencing fertility challenges, a lot of women are trying to have sex on day 14 of their cycle. A lot of women are using ovulation predictor kits and waiting for that positive, but not a lot of women recognize and know how the anatomy works. So the best days to have sex are on the mucus.
Exactly. I know. And then they're like, oh, but I need to time it. And I have to do it every other day. I'm like, no, just look for the mucus.
Yeah. And not every woman ovulates on day 14. And it's more important to hit the days of mucus than it is to hit any particular day of the month. Because again, the sperm, it's like, think of your cervix as a hotel for sperm. Your cervix is the end, the lower part of your uterus. And it has all these cool little folds in there called the cervical crypts. And when you have your mucus, you have sex, the mucus draws the sperm into your cervical crypts and they hang out there for days, having a party. And then when as you approach ovulation, you're as women too, there's kind of that myth that the sperm are the superheroes and they're kind of doing all this cool stuff and swimming around, but our bodies do all the work. So
exactly. I know, we're always doing the work.
Yeah, I know, right? So the mucus draws the sperm into the cervical crypts. As you approach ovulation, it's really interesting, but your mucus actually kind of pushes the sperm into the uterine cavity. Your uterine cavity has these smooth muscle contractions that draw the sperm into the fallopian tubes. So even though you had the sex days ago, your body is still organizing the situation so that the sperm are there and ready prior to ovulation. So I think if I could smash any myth, especially with women who are struggling with fertility, it would be the myth of day 14 sex or every other day or any of that stuff, and just say, look, just focus on the mucus.
Exactly. Now, on the other side then, so women that don't necessarily see the mucus, then they panic, right? Because they know about the cervical mucus and then they don't necessarily see it. Now, are there women that don't necessarily, when they pee, feel that like slippery, slopey thingy? Could they actually just have to like insert their finger or something to check it out?
Well, see, it really depends. So as an educator, you could say, I know too much. So to put the myth out there, not all women actually are able to have enough that they can stretch it between their fingers.
Exactly.
And there's a difference, I think, as women, because we don't know much about mucus, we don't also know about how the natural aging process can affect it. So a woman in her early 20s who's not on birth control may see up to 6 or 7 days of mucus prior to ovulation and have quite a bit of the clear, stretchy several times a day for several days as she approaches ovulation. But it's natural and normal that as we approach our late 30s and 40s, that we're actually going to have fewer days of mucus. So when you look at what the research has to say, on average, a woman in her 40s may see 2 to 3 days of mucus on average versus a woman in her 20s who's going to see more. So first of all, fewer days of it as we get older. But also, we may see less of it. And there's other factors that can contribute to cervical mucus production. If a woman has been on the pill for a really long time, the pill also suppresses mucus function, and it often takes a bit of time for the cervix to kind of rebound and produce again.
Yes. So let's talk a bit more. Okay, now we're going to fly over to the other side, which is about talking about the impact of the oral contraceptive pill, which so many women come in using, right? Or having used it. So tell us more about other impacts that it may have on our bodies.
Yes. Well, Mary, I want to jump into that. I'm thinking of the woman who doesn't have a lot of mucus, and I just want to give her a couple of tips, if that's okay.
Absolutely.
Okay. I just want to also point out that for a lot of women, if you've had HPV and you had to have like a cervical surgery, for women who are in that category, they may not see a lot either.
Yes.
So there's a couple things to know. A lot of women have heard about the clear stretchy, and so they think that if they don't have the clear stretchy, that's it. They can't get pregnant. Some women will only see the creamy mucus, like the one that looks like hand lotion.
Right.
And it's important to know that it's fertile too. So it's all fertile. And for the woman who doesn't see a lot, sometimes all she might have is that slippery sensation when she wipes. But then most women aren't paying attention when they're wiping. So I just want to kind of point that out there. For a woman who doesn't see a lot, the first step would be trying to kind of figure out how to check and look into that a little bit more. If she's comfortable and she's into the fertility awareness method, then she could also check for her cervical position and start to recognize how the cervix when you're ovulating or when you're in the fertile window is softer. It's typically higher. It often feels open, like a dimple or something like that. So I'm just trying to help her to identify when she's fertile, even if she doesn't have a lot of mucus.
Yes. Good.
But yes, the birth control pill, I mean, where to start? All the different effects that it can have on the body. Some of the most common effects that women experience include depression and low libido. And that's partly because of the influence that the pill has on testosterone. So when women are on the pill, it profoundly suppresses their free testosterone in a couple of ways. So first of all, it suppresses your ovarian production of testosterone. So our ovaries produce some estrogen, progesterone, and some testosterone. But it also raises our production of a protein called sex hormone binding globulin. And to put it in a, like, I like kind of a visual kind of thought about it. As women, we produce about 90% less testosterone than men. So we know we're not producing as much, but we need the testosterone that we do produce. And it is related to mood, and it is related to libido, and it is related to sexual function, and even the sensation of our reproductive organs. So our vulvar tissues are very sensitive to the production of testosterone. And so when I talk about that sex hormone binding globulin, just think about testosterone kind of flowing through your body like that image of a person with a group of iron filings and a magnet. And so if the iron filings were your testosterone, the sex hormone binding globulin would be the magnet. So when you have the pill, a lot of that testosterone that we would normally have available to us is bound and unavailable to our cells. So for a lot of women, they experience either a complete shift in libido to the point that there's a running joke that part of the reason the pill works is because you don't have sex anymore.
Right. Yeah.
But in addition to that, when you take that testosterone, make it unavailable, what the research tells us is that as women, when they actually measure our vulvar tissues, so there's studies where they measure clitoral volume, they measure the thickness around the opening of your vagina. When you reduce the testosterone so significantly, it's associated with shrinkage of these tissues, which for some women can result in a lot of pain with sex. And often these women, because we don't really know of the connection to the pill, they may be struggling for years before they even make the connection that the reason that they're experiencing pain with sex or low libido could be even related to the pill.
And then so when you get off the pill, are there these long-standing effects, or are they permanent actually?
There's no, I mean, it would be so, as someone who publicly talks about the pill all the time, it would be so nice to just be able to throw it under the bus. But when you actually look at the research doesn't indicate that these results are permanent. In terms of the testosterone, there are studies to show that, I mean, it does rebound, but it takes time. So it can take anywhere from a year to 5 years or more for the levels to completely go back to normal. But you don't want to, as women too, I've used the pill. A lot of women, like up to 80% of women have used the pill. So I think it's helpful to know that even with the testosterone and the libido, a lot of women do find that it does come back, although it can take some time. And there's no research to suggest that for instance, even the shrinkage of the tissues is a permanent thing. so, I mean, in addition to that, the pill's linked to depression. And as I mentioned, partly due to the testosterone, but the pill's associated with a whole host of nutrient deficiencies. So
Yes.
one of the reasons it's so closely linked to depression is because the pill significantly depletes vitamin B6. I liken it to having a bucket full of water with a hole in it. So the pill is known to deplete B vitamins, including folate and vitamin B12. But when you look at the research, if a woman is, what some of the researchers do with the folate studies is they actually allow the participants to take folate as a supplement, and then it kind of counteracts that a little bit. Like, it doesn't completely resolve it, but it does counteract it a bit. But with vitamin B6 in particular, it depletes it so significantly that you'd have to take like 4,000% of the recommended daily allowance. Like anywhere from, I think it's about like 20 something to 38 times the recommended daily allowance of vitamin B6 to counteract the deficiency. So vitamin B6 is linked to our production of tryptophan and our production of serotonin, which is associated with our mood.
Exactly.
So there's like a really specific link to depression and anxiety and all of those types of effects on the pill. And not all women experience it in the same way. So you, Mary, as well as I don't know that some women go on the pill and right away they have these strong reactions and they have to come off. Other women experience it in a very subtle way, and it kind of gradually gets worse. And eventually they start to question why they have these mood kind of related symptoms. Whereas other women are on it for years, and then like literally like 5, 6, 7, 8 years in, they start having panic attacks.
Yeah.
So it really depends. It affects women differently. And because as women, we're not necessarily told about the link, if you do start to feel depressed, or if you do start to have some of these effects, you're often making that connection way later, right? Like you kind of think, oh, it must be me. There must be something wrong with me. Maybe I'm not that sexual. Maybe there's something sad happening in my life, and that's why I'm feeling depressed. It's often not until later on that women have the opportunity to make that connection that it could be related to the pill.
So now, of course, we're dealing with an audience that is getting off the pill.
Yes.
So we want to look at more the postpartum, sorry. Excuse me. Post-pill amenorrhea, or like lack of menstruation, or, other effects post-pill. Can you address that?
Yes. So more specifically, the effects on fertility.
Mm-hmm.
Well, it's interesting because when you look at the research, the pill and other hormonal birth control is associated with a temporary delay in the return of normal fertility. And so you had asked, like, is it permanent? Is there research to show? And of course, the question would be like, is there research to show that the effect on fertility is permanent? And again, the research does not support the idea that there's a permanent detrimental effect on a woman's fertility. It does, when you look at the research, the pill is classified as a reversible contraceptive. But I think the part that is missed when women are being counseled about it is that when a woman comes off birth control, it takes time for her body to go back to normal. So there's some studies that look at the menstrual cycle, and we talked about all the different phases of the cycle today. So when a woman comes off the pill, on average, it takes anywhere from 9 to 12 cycles before her cycles return back to that normal in all areas. So her periods are normal. She's ovulating, around the time she's supposed to in a healthy cycle. That would be somewhere between days 10 and 23, with an average about day 15.
Exactly. So let's just say it again. 9 months, guys.
No, I didn't say months. Yeah, I have to correct you. 9 to 12 cycles.
Cycles. And you're right.
What that could mean could be 12 to 18 months or more, because
exactly,
some women don't get their period back for 3 months.
That's right.
And so that first cycle could be 50 days, and then the following cycle could be 36 days, until her body gradually gets back into that healthy cycle somewhere between 24 to 35 days.
And so I hope that you guys get this, because because this is what happens. Like, a woman's on the pill for, 5, 10, 20 years, and then your late 30s, early 40s getting off the pill, and you expect your body to behave like bang, right? And it takes time to recover. And unfortunately, what then happens is then you panic and you go to the fertility clinic, and automatically you're going to get assessed, and then they're going to look at your hormone panel and they're like, oh my gosh, you're going to hit menopause or something like this. And meanwhile, they're catching your body at a place where it's completely out of whack, and it just needs to help be normalized and rebalanced, that you're not necessarily in menopause, but that's what they get at the fertility clinic.
Well, let's talk about why that is. When I was researching for kind of the chapter on basically like the effect post-pill on fertility, I came across some information, essentially some studies that have been done on ovarian reserve parameters and how the pill affects those. And it's interesting because when you're looking in the research, sometimes you have to look where the money is. So the place I found these studies was in the area of fertility preservation. So they were looking at women who were coming off the pill and looking to get like their eggs harvested.
Right.
And so basically what the research found is that when women come off the pill, the ovarian reserve parameters are down. They are down for a period of at least 6 to 7 months. So the main things that they looked at in the research were the ovarian volume, so quite literally the size of your ovaries, as well as anti-Müllerian hormone and antral follicle count. So in these research studies, they're looking at those, and any woman who's been struggling with fertility knows that these are the things that they're looking at. These are the tests that you're getting. So a woman post-pill, the ovarian volume, which is particularly disturbing, was 50 to 60% lower than normal, meaning that there's research specific evidence to show that the pill actually shrinks your ovaries. And I feel like I've heard surgeons talk about this because, of course, as a surgeon, you actually see a woman's, I feel like I first heard that from a surgeon who kind of made a flippant comment of like, oh yeah, when a woman's on the pill, her ovaries shrivel up like almonds or something like that, which is very hard to hear.
Yes.
But then when you actually see the research showing the ovarian shrinkage of 50 to 60%. So when women hear this, of course, it's very alarming, but there's no evidence to show that it's permanent. But what it means is that there's a physical change in your body as a result. I mean, what is the pill doing? It is suppressing ovarian function. It's suppressing ovulation. So obviously over time, it's having a physical effect on the ovaries because they're not really being used. They're just sitting there. And then
let me just add in a tiny little analogy. So, you know, people work out. If you stop working out for 10, 15, 20 years, your muscles are going to be like nada, right? Like nothing. But it doesn't mean you can't build those muscles again. So ovaries, it's like smooth muscles. So you can, but you can't expect it to work like this as soon as you get off the pill. And that's, I think, the pitfall, because women will automatically believe that this is a permanent state of being. And then the only way is to go straight into IVF because, you know, their days are numbered.
Mm-hmm. Well, and if you think about it, so with the way that we think about testing, we often think that it's kind of an ultimate measure.
Yes.
So if a woman has just recently come off the pill and she's getting the measure of her anti-Müllerian hormone and her antral follicle count, those are shown to be much lower immediately post-pill. So if you are getting that test at that stage and it's showing that you have, like you said, menopausal results, and you're taking that to mean that that's a reflection of what's actually happening, as opposed to acknowledging this period of transition, that's highly problematic. So the way I see this is that as women, like the problem from my perspective is that we're not told about this temporary period of subfertility. We're not told about this transition period. And so, and also as a fertility awareness educator, as women, the decision of when to become pregnant is very emotional. And so it's very possible as a woman, as I'm sure everyone who's listening knows, for literally 1 month for you to be absolutely like, no, I can't get pregnant. And the next month you're ready. And when we make that shift emotionally, we're ready and we want the pregnancy to happen right away. But if we don't have this knowledge about how our bodies work and this transition period off the pill, our bodies aren't aligned to that. Because so if you look at the research, so there's the research on the parameters and how long it takes for the ovaries to go back to normal and how long it takes for the cycles to go back to normal. But there's also research on time to pregnancy. So there's a lot of time to pregnancy studies where they specifically look at women coming off of different types of birth control and how long it takes them to get pregnant. So like the first things first, a woman who's not on any birth control, she's not on any hormones, she's using condoms to avoid pregnancy. There's one study that I was looking at where, and it's pretty common knowledge. The average couple takes about an average of 4 cycles to get pregnant. There's an average of about a 25% chance of conception.
Depending on the age.
Depending on the age, of course. And so, but if you come off of birth control, the one study I was looking at, the women in the study coming off of the pill, so combined hormonal contraceptives that contain the synthetic estrogens and progestins, it took an average of 8 months. Average, meaning some women got pregnant sooner and some women got pregnant later.
Yes.
And then if you were using something like the depot shot, the average, that's the highest, the average was 18 months.
Oh.
Yeah. So it depends on the type of birth control. But think about, so this is the picture that we need to paint, because I think, Mary, this is what you're wanting to say and I'm wanting to say, and we're so passionate about. It's that so picture yourself, you've been on birth control your whole life, you've been very responsible. You're finally ready to get pregnant, everything's aligned. You come off the pill, you even potentially made an appointment with your doctor and asked, I've been on the pill for 10 years. Do you think I should come off early to give myself a break? I've talked to so many women who went through that and their doctors are like, no, it's totally fine. So you come off the pill literally expecting, you're cool at first. Like the first cycle, you're like, you know what, this is okay. But by the second cycle, when your period comes, you're already kind of freaking out a little. And by 6 months, you're already in the fertility clinic. And
exactly.
Nobody told you that it could so 9 to 12 cycles means 12 to 18 months or more. So in a perfect world, you would be like, if in a perfect world, if we had this knowledge, then about 18 months to 2 years before we're ready to start trying, we would be coming off of the hormones and finding alternative ways to avoid pregnancy and just taking the time to prepare our bodies. But because we're not even given that information, it's really hard, because you know that not every woman has that amount of time to just wait for her cycles to normalize. But at the same time, your body might need that. The research shows that your body actually does need some time to rebound, for your hormone levels to go back to normal, for ovulatory function to resume normally. By the time you're at the fertility clinic, by the time you're on your 3rd round of Clomid, your body would have just been getting back to its normal routine.
Right. And people don't even wait for that. They just go straight to the clinic, and they're all of a sudden immersing themselves with more drugs, more hormones, acting on a different realm with the hypothalamus and pituitary ovarian connection. But then, and then they wonder, oh, gee, why am I not getting pregnant? And then they say, okay, let's take a month break. And then it's like, oh my gosh, my body's not doing what it's supposed to do. It's like, well, you know what? Your body has never normalized in the first place. So we can't expect it to function as it should normally, right? Because it's been bombarded so much. And I've always put it to, gosh, your body becomes a little lazy, right? Because you've been giving it drugs, hormones. It's like, oh, I don't have to do anything because, the pill's going to come. I'm good, right? Whether it's completely asleep or it's going to be forced ovulation through a pill. So not giving it time.
Yeah. Well, and then, a big part of it too is that as women, if you don't conceive within the time frame that you have allotted for yourself, we automatically assume that there's something wrong with us and that there's something wrong with our bodies.
Yes.
And so, as a fertility awareness educator, I have a specific perspective on this. And so the only thing I could suggest for women who are listening, who might not already be in the middle of this, who have that pregnancy kind of for the thought in the future, there's some cushion there in terms of when you're going to start trying. I would recommend to just come off the pill sooner than later. Give yourself 18 months to 2 years. And it sounds like a long time, but your body needs it. When you look at, if you start charting your cycles, I do these programs, I do these group programs, and I work with women. And so I've seen what happens when you come off the pill. And so to give a few examples, I've worked with women who join programs with me right after they come off the pill. I've seen it in several cases where she has no mucus for the first 2 or 3 cycles. And I mean, no mucus. She's checking. I teach a very detailed method. We're checking frequently. We're looking at things. We're being very, paying really close attention to detail. But she's ovulating because we're paying attention to her temperature and things like that. And it comes back, but it can take a couple of cycles to come back. Even just the thought of that for a minute, for it to take a couple of cycles before you start to see your mucus again, before your cervix starts responding to the estrogen that you're producing, potentially before your ovaries are starting to produce estrogen at the level that needs to happen in order to have a healthy cycle, and progesterone and things like that. Just to have that concept of okay, it does take time. It's like if you had a car that, you put a cover over and left it in your driveway for 5 years or 10 years, you would probably think, okay, I'm going to have to get it checked out, go to the mechanic, fix all the things, put in all the fluids, do the whole thing just before it's going to run. You would expect that if you tried to start it the first time, it would sputter a bit and, you need to give it a little extra TLC. If you shut your ovaries down for 10 years, it's the same idea here.
Oh, yeah, absolutely. So you say 12 to 18 months ahead of time to get off the pill?
I say that minimum. I mean, I say 18 months to 2 years. And part of the reason I say that, it's one of the things that you had asked about earlier on that we didn't get to was post-pill amenorrhea. So there's a certain percentage of women who come off the pill and their periods don't start for several months or even a year or more.
I was one of those. Absolutely.
Well, and the hard part about that is, again, the research doesn't suggest that the pill causes that. The research suggests that the pill masks it. And so what's interesting when you look at the studies on, so even when they're looking at the time to pregnancy studies or how long it takes, they will exclude women from the studies who have a history of abnormal or irregular cycles or amenorrhea. So within the scientific community, they know there's a recognition that women who previously had cycles that were, very irregular, or they did have amenorrhea, that there's a pre-existing problem there. So when they come off the pill, they're more likely to have issues with it. So
we also see women who did have regular cycles though prior to pill, and then they still are amenorrheic, meaning lack of menstrual cycle, guys.
Well, and in that type of situation, so I've worked with and interviewed a few women who, I did a couple of episodes, 2 episodes come to mind specifically, where one of the women came off the pill and she didn't get her period back for, I think it was 4 years. It was a really long time. So that's not a typical experience. But one of the things, because a lot of women think that when they're on the pill, they're getting a menstrual cycle because, you're getting a period every 28 days, right? But when you're on the pill, it suppresses ovarian function. And when you bleed, it's not a menstrual cycle. It's a withdrawal bleed. So basically you take all the synthetic hormones and then you stop taking it for a week, and then your body gives a bleed, but it's not a period. It's not a cycle. So if, for example, if you had a pre-existing issue, and then you take the pill and it gives you a bleed every 28 days, it gives the illusion that you're getting a regular cycle, but you already know you had a pre-existing issue. So in that case, you're more likely to have issues when you come off in terms of the period not just returning regular, because your period was never regular. On the flip side, women can develop, so for instance, hypothalamic amenorrhea is typically associated with a combination of undereating, over-exercise, and stress. And so there are women out there who, because of our society and the way we look at women's bodies and things like that, feel a lot of pressure to have a body that looks a certain way, and they gravitate to a lot of exercise and or restrictive eating in order to achieve that goal. When you're on the pill for a long time, you're always getting that bleed every 28 days. So if you were to develop this issue, in the middle of taking the pill for 10 years, you were on the pill, so you didn't know. So it was masking that. So I just want to clarify, there's, from what I was reading in the research, there's no evidence to say the pill causes hypothalamic amenorrhea or post-pill amenorrhea. But it would seem as though if you had that condition, you wouldn't know, because you're getting a bleed every 28 days when you're on it, right?
Right.
So then you come off of it only to discover that the period doesn't come back. So when I say 18 months to 2 years, especially for women who had a history of irregular cycles or problematic periods or things like that, it's because you literally don't know. It's like buying insurance. That's why my analogy for it. It's like you want to hope for the best. Like you hope that you're going to come off and your period's going to come back the next month. And it's really just going to take a couple of months for everything to go back to normal. Of course, we hope for the best. And we know that some women get off the pill and get pregnant right away, but you don't know if that's going to be you. So taking that extra time, if your period didn't come back for 6 months, if you come off the pill 18 months to 2 years prior, you actually give yourself time to deal with that.
Yes. And that's, you hit the nail on the head, because here you are, you're basically masking you've been talking about this all along. It's a 5th vital sign. So when you take the pill, then you're just masking it and it looks like, oh, gee, I'm having a bleed every month, right? But meanwhile, you're masking what is already there. And you gave the example of someone that can be thin and athletic and aren't amenorrheic, but then there's the flip side too, right? So people that can be more overweight, when they may not have a bleed either. And certainly people with polycystic ovaries, right? You're masking out all those kinds of conditions, and or people with endometriosis, you're masking that with the pill sometimes as well. So it's like, and when you get off the pill, then it's like, oh my gosh, there's actually something to treat. And it's like, wouldn't it be better if we were treating it all along and not utilizing the pill, or even acne, right?
Yeah.
So all those kinds of things, you're just masking. Yes, it's great during the time that you take it, but it's really not helping whatever trial and tribulations that you've been dealing with in the first place.
Mm-hmm. Well, and whenever I'm talking about the pill, I always feel compelled to share and kind of clarify my stance on it, because I mean, I come across as super anti-pill. But like I said, I mentioned already, I took the pill when I was a teenager. I had really heavy painful periods and I didn't know what to do. I literally went to the doctor and I wanted the pill. Because I was athletic, I was doing all the sports and stuff. And I said 3 words and he was already writing the script. But that was my intention when I went to the doctor, because I didn't know how else to deal with it. So I believe that what's important is having that information. So if we know about this temporary period of subfertility, if we have that understanding that you don't have a real period when you're on the pill, it masks your true cycle and you're not really seeing what's really going on there, then at least that gives us the ability to make informed choices. So I think women fall into 3 categories essentially with this knowledge. So if we're all adequately informed about the pill and how it can affect us and how it can affect fertility, some women are going to say, okay, you know what, that's too much. That's not for me. I'm not going to take hormones. And they're just not going to do it. Some women are going to say, you know what, I get what you're saying. I think for this phase of my life or for this period of my life, the pill is the right choice for me. But because I know about the side effects, I'm probably going to modify my use. So
Yes.
maybe instead of 10 years, I'd take it for 3 or 4 kind of thing.
Right. Yes.
And then for other women, they're going to take it for just as long. And I think it's important to recognize that. But the point here is that we have the knowledge, and then we can make the informed decision for ourselves.
Very good. I love how you put that. Yes, because this is not about judgment. It's your own personal choice and what's right for you and your lifestyle. But the main thing is that just know then that post pill, when you want to conceive, you might require some longer time to get everything back to working order, right?
Well, because I wonder, if every woman was fully aware, if this was really common knowledge about how there's this temporary effect on fertility, and it was just advised, because women, we're really smart. The women who go on the pill to prevent pregnancy, we're like doing it. We're getting our careers in order. We're going to school. Like, we're really intelligent. We're smart. We're capable. We can handle it, right? We can handle the truth. So if we knew about this, then when we're planning for everything else, we plan our weddings, we plan our careers, we plan all kinds of stuff. We would be able to just put this in our plans and say, okay, you know what? My doctor informed me that there's this temporary delay in fertility. And so, my doctor advised me that I should come off the pill several years, or like in my 18 months to 2 years is my recommendation, but to come off the pill in advance, to give my cycle a chance to return to normal. We would do that. We're smart. Just give us a chance. Just tell us so that we can do it.
Absolutely. And you know what, we know actually, maybe we don't know. We don't know going in the side effects of the pill. No. And I love, and in your book, I believe you cited about men going on the pill and how it was completely kibosh because it's men.
Yeah, well, so there was a study that came out a couple of years ago, and they came up with, it was essentially kind of like Depo for men. So they were giving men a hormone, I think it was estrogen. I would have to double check, but they were basically giving men a hormone that would suppress their testosterone and prevent them from making sperm. So doing essentially the same thing as the pill does for women. And essentially what happened on this, it's really hard to read, actually, if you read through the whole study, because the men in the study experienced the same type of side effects as the women do on the pill. So it was kind of like the men, some of them had an increase in anxiety, depression, mood disorders, erectile dysfunction, issues with ejaculation and maintaining erections and things like that. So quite literally like sexual dysfunction, mood stuff, like the same stuff. And midway through the study, a safety committee jumped in and essentially shut down the study because they concluded that the potential benefits of this drug did not outweigh the risks. And so the study was shut down in the middle. And there was even, there was one gentleman, one study participant who took the drug for the whole time, and he committed suicide in the trial. And when you read the study, it says that, the death was assessed as not related to the study regimen, but they literally shut it down. And so, of course, that leaves me and a lot of other women who have read the study just with the question of like, okay, women take the pill today and we still have those side effects. Exactly. And it wasn't hard for me to find research, Mary. Like there are studies and studies and studies and studies on the way that the pill impacts hormones and moods and all this kind of stuff. And so essentially it feels like there is a giant uncontrolled experiment that has been going on with women's health for the past 60 years since the pill came out in 1960. Whereas men literally, they gave the men the drug for a couple of weeks. And then as soon as they had a little bit of like, a few symptoms that are exactly the same as the ones we're experiencing, they're like, no, that's too dangerous.
Yeah.
So, I don't know what to say. This double
well, the moral of the story, in my opinion, is that we women as a whole need to speak out and stick up for ourselves as well. It's like, you know what? If you're having, and so by the way, for those that choose to be on the pill and are on the pill and you're having symptoms, you actually need to be more vocal and tell people. We're just like silently enduring.
Yeah. But part of it is because we don't know. I've spoken to so many women who it literally goes like this. Like I've spoken to women who have the anxiety and the panic attacks, and some women describe kind of having paranoid thoughts where they just think they are the ones that are crazy. I know we don't like to use that word, but they feel that way. And then it's literally like they're fed up. They've tried everything. They've changed their diet. They've done everything. And eventually they like desperately Google in the middle of the night something about pill mood, pill side effect. And then they find their answer. We shouldn't be leaving women to have to desperately Google in the middle of the night. Yeah. So in the book, I have this in the pill chapter. I one of my friends told me I should make it into a t-shirt. So I don't know, but I basically put like what the side effects of the pill should look like. So if you were thinking about taking the pill and you're sitting down with your healthcare practitioner, and it literally like here, I'm gonna find it, and if I can find it quickly, but like I just want it because okay, I'm not very good at finding things, so I'll give it like 10 seconds, but I want to read it. Okay, here.
I know. Okay, good. I'm glad because we got to go. This is supposed to be 20 minutes for Pete's sakes.
Oh, I'm sorry. You should have told me. I'm not known for
No, it's okay.
So
no, it's okay. I love it. And, for people, I think it's so informative. But the problem is people have like a short attention span. So, we could have broken it up to like multiple interviews, but it's okay. Let's go. Okay. Read it.
Super quick. Warning, hormonal contraceptives increase your mortality rate by increasing your risk of developing deep vein thrombosis, ischemic stroke, cervical cancer, breast cancer, and liver cancer. This product has been shown to cause clitoral shrinkage, shrinkage of the vulvar tissues, ovarian shrinkage, vulvodynia, painful sex, low libido, loss of sex drive, depression, anxiety, panic attacks, migraine headaches, irritability, intrusive thoughts, emotional outbursts, mood disorders, multiple nutrient deficiencies, recurrent yeast infections, persistent HPV infection, cervical dysplasia, weight gain, insomnia, fatigue. Like it just goes on and on and on, right? So like
it's crazy.
It doesn't mean that no one should ever take it, but it means that we have to be at a point now where we're fully informed about the risk, so that we can just, because the thing is like you just need a heads up. You just need that person to tell you like, if you go on the pill and start developing yeast infections, it could be related. If you go on the pill and start feeling really depressed and lethargic and all that kind of stuff, it could be related. Because then if it happens, because it doesn't happen to every woman in the same way, but if it happens, then you can just be like, you know what, my doctor mentioned that I might have low mood, and that's one of the side effects. So let me just go off of it for a month or two and see. We're denying women the chance of essentially just being able to kind of get to that stage earlier.
And by the way, and if you are that person in that category and you're doing fertility treatments at the fertility clinic, it's like buyer beware, right? Because a lot of times you downregulate and you're actually given the pill before you take stimulation drugs. So just know that if you feel like you're going crazy when you take the drugs, sure, you signed up for it, but just know that you're not going to be your normal self. And a lot of women express this, right? It's like, oh my gosh, I'm a bear. Like I want to kill my husband, while they're on this. And it's like, okay, well, it's a choice thing. We can either ask the doctor to see if there's something else, if you know you're that person. Or if you're going to bear it, just like you might need a whole team around you so that they know that you're going to be some kind of intervention.
So at least in advance,
yeah.
Because again, we're smart. As women, we can handle the truth. Like, you just have to tell us. If you tell us the truth, then we know, like we both know, and then we can make those decisions. And it's not like a woman who's going to fertility treatment is going to, like, maybe she'll say, I'm not going to do it, but chances are she'll say, thank you for telling me. Now at least I can prepare myself.
Absolutely. Absolutely. And so, sometimes they'll give the pill before they start the stimulation drugs, give the pill now, even for frozen embryo transfer. Like they want to just control everything. And I think 3 sessions ago, I interviewed Dr. Vero. He might kill me if I tell you guys this out loud, but I don't care because I think it's really important. So there was witnessing that there's the actual frozen embryo transfers, there's better uptake, better clinical success when you do natural frozen embryo transfers versus using hormonal drugs to control your ovulation so that the doctors can time it for their convenience or for your convenience in your lifestyle. Crazy, right?
Mary, I got to say, as a fertility awareness educator, it has always blown my mind, because if you're charting, you can quite legitimately identify as you approach ovulation. And then if you really want to get as close as you can combine your fertile signs with an ovulation predictor kit. I think they should be used together. And then with your temperatures and your mucus observations, you can confirm like when it happens. So you can really get pretty close to ovulation just by monitoring your own cycle. So
totally.
My question has always been, like, for a woman who's cycling naturally, is it necessary to force her to ovulate when she's ovulating normally already? And I've always thought that way.
Yeah. Well, that this will be at a 10-hour talk. So we're going to cut it off here. There's a lot more, but we can do another one at some other point. It's very interesting. And as women, we need to know more. And so we can have more informed choice. Absolutely. So that's what we're here for. And that's why we're here, guys, to give you guys the information so you guys can be empowered with choice and go, yeah, okay, I'm going to do this, or I'm not going to do this, for Pete's sakes. Right?
Yes.
So thank you, Lisa. Like, I love it. Like you're passionate about it. You're teaching. I know. And for you guys, well, you won't know, but Lisa actually has another job altogether. But was it your personal experience that drove you to do the Fertility Friday?
Well, yeah. I mean, I was in the fertility awareness space for a really long time. I was teaching women to chart in my early 20s. I took a training program back then, and I was teaching. Right. And so part of the reason that so it's always been something that I've been doing and actively involved in, but it was never like my primary career until within the last few years. So what happened was, like a lot of women, I had a baby, and then I kind of looked around and realized, like, all these years I've been taking for granted this knowledge. I understand my cycle. I know how to tell when I'm fertile. There's so many women that are struggling to get pregnant, and Absolutely. Very few of them know how to identify the fertile window. So I felt compelled to put it out there.
Well, and I thank you. And for those of you who don't know, again, she's the author. Lisa is the author of the book, The Fifth Vital Sign. Can you put your copy of your book so people can see? It's awesome. And just so you know, Marie, who is, I hope she's not going to be mad at me for saying this, but so she's my patient care coordinator, and she's highly interested. She's read your book now because I let her. Thank you for the copy of the book. And then now she's telling all her friends, because she's in that age group, right? So she's telling everybody to read your book. And I think it's a really great starting point to really learn about your body, to get going with just your overall fertile health and overall health, really. And then you can go from there and choose wisely, right? As you're trying to conceive or prevent conception, of course. So thank you. Thank you for creating this into the world and making a difference. Love it.
Thank you for having me. We had a great long chat. Thank you.
I know. Long is right, but that's okay. I think people will be interested in this. So thank you guys for watching, and you can scroll down because there's now, like 129 videos that you can go through. And certainly also, and check out, how many do you have now? A gazillion?
I was just recording 262.
Yeah, see? So, wow, that's awesome. And so Fertility Friday, that's a podcast, so that you can go and like listen on your phone, or not on your phone, like when you're driving or commuting, whatever. So I need to start doing podcasts too, but one thing at a time. All right. So have a great day. Oh, you know what? At the end, maybe you can type out all your info on the comment section. Okay.
Cool.
So bye, guys. Join me next time, and we're going to have lots of fun, more juicy stuff for you. And if you haven't checked out my book, Pathways to Pregnancy, go check it out, Amazon or any bookstore near you. Okay, ciao for now. Have a great day. Bye. Thanks, Lisa.
Thank you.